Hey guys, in this video I wanted to go over this flowchart that I found while reading some papers recently. I think it just does a really good job in describing some of the mechanisms of hip labrum injuries that we can commonly see in cutting athletes. So sports like hockey, soccer, basketball, some of those sports that we know that these athletes have this type of injury based on MRIs that we've done. And I think this chart just shows where that injury comes from, because it's not like a traumatic injury, right? It's more of an overuse, kind of something that develops over time. So I think knowing where it comes from is helpful in then trying to prevent further symptoms for this kind of injury. So we're going to start down here with the abnormal morphology of acetabulum, femoral head, or neck. Basically, that is just describing hip impingement, or FAI, also known as femoroacetabular impingement. So FAI is really just extra bony growth, either on the femur, on the hip socket, or a little bit of both, where you get a little bit on the femur, a little bit on the hip socket. This creates a problem because when the athlete is out playing their sport, whether they're running, jumping, skating, we get some repetitive movement coming from the hip. And the hip labrum is kind of an extension of the hip socket, so it sits right there. And when the athlete is out moving, these bony growths pinch together, and they pinch the hip labrum. So that can lead to fraying of the labrum, it can lead to tearing of the labrum. It can basically, it leads to a labrum injury. So it's not necessarily painful or symptomatic, but we do get the fraying and the tearing of the labrum. So I like to think of the labrum kind of as like a suction seal, almost like a Nerf bullet, right? When you stick the bullet to the window, it sticks. So that's the same idea with the labrum on the femur. But with the injury, with the labrum injury, we lose that suction seal, right? So that the femur can actually slide a little more inside the joint. So if the active stabilizers of the hip, so the muscles, aren't prepared to take over and create that stability of the joint, we're going to get more femoral head translation. So basically the head of the femur is going to slide more in the joint, right? It's going to slide back and forth. And then that's going to lead to it sliding and bumping into the labrum, which is going to lead to more injury on the labrum, right? And then we're going to get less suction seal, and it kind of becomes just a big cycle of labrum damage. So I think we can do a better job of working on this stuff with these athletes, even though they don't have symptoms, right? I think working on the active stabilizers can help prevent further injury of the labrum that we know most of them will probably have, and it will hopefully help prevent any kind of symptoms that will develop and keep these athletes playing for longer. So in the next video, we're going to talk more about the mechanism of repetitive load on the hip from these sports. So stay tuned for that, and thanks for watching.